Officials continue to emphasize the need for accurate testing to identify people infected by COVID-19, but research is calling into question the accuracy of some tests. Dr. Frank McGeorge is here with a concern and when they're most likely to be accurate. Doc?
Well, Kim, imagine getting a test for COVID-19 because you work at a job where you come in contact with lots of people, or maybe you're going to be visiting your elderly grandmother in her nursing home, and then you're told the test is negative. You feel like you're good to go, right? Well, according to recent studies, it could be falsely negative around 20% of the time.
Two recent papers are highlighting a need to re-examine the accuracy of the nasal swab PCR tests that we use to identify active infection with COVID-19. The most recent one, published in the New England Journal of Medicine, is specifically calling on the FDA to better highlight the problem and provide clearer prediction rules that factor in this inaccuracy. Meanwhile, another paper, published in the Annals of Internal Medicine that looked at published information from 7 other studies with over 1,300 patients, found COVID-19 tests may tell a person they aren't infected when they really are, an average of 1 out of 5 times. Interestingly, they found the timing of the test relative to when a person was infected played a significant role in how sensitive the test was. On the first day of infection after exposure, the false negative rate was 100%. None of the tests were correctly positive. By day 4, the number decreased to 67% of tests incorrectly identifying a person as negative. On the average day of first symptoms, day 5, the tests did better, 38% false negatives. And it wasn't until the 8th day that the false negative rate reached its low of 20%. After that, the false negative rate increased again from 21% on day 9 to 66% on day 21.
Now, since the beginning of the spread here in Michigan, I have definitely seen plenty of people that initially tested negative only to turn up positive on retesting. So the bottom line is that when we interpret a negative test, there are many different considerations, from the timing of the sample to the quality of the sample to the pre-test risk that someone might have.
Yeah, well, talking about testing, Doc, and relative to current events and the concern people might have been infected at these protests that we're seeing, is there a best time to maybe get tested?
Well, the data clearly doesn't support getting tested the very next day. Based on this report, isolating yourself for a few days and then getting tested around day 5 to 8 is probably a lot closer to optimal.
Yeah.
Back to you.
Yeah, interesting. Okay, thank you, Doc.